The $7 Medicare copayment for GP visits was one of the most contentious issues arising out of the recent federal budget. The government claims it will deter unnecessary GP visits, but many members of the public feel that it compromises access to healthcare. We hit the streets of Perth today to ask if you think Australians should pay a $7 Medicare copayment.
We already pay enough for seeing a GP, so I don't think it's fair that we do have to pay another $7.
Yes, because nobody gets anything for nothing, and GPs have to cover the costs of their rising costs of running their businesses.
I don't think it is absolutely whatsoever, because there is people that can't actually afford their payments, but then there's some that actually is. Well, it's good for people that can't pay their payments, you know, they've got their benefits and all that, but people that do pay their payments, they can afford it, but it's just not good for them in a way. You know, we should all have the same fair price, but we should all have a fair go.
Enough medical fees and insurances, everything, it's out of control. Where do we stop? $7 one week, $14 the week after.
I'd be quite prepared. I think at the moment my doctor bulk bills, and I'm prepared to pay the $7.
We've already paid our Medicare levy. We pay our levy in our tax, and it would cost more than that to administrate anyway. I'm totally against it.
It discriminates against the low-income earners and the elderly and children as well.
Definitely, yes, definitely does. I think you're going to hear a lot more of it in the near future. It's only the tip of the iceberg so far. People are not happy with the government system at present, and it's going to show.
Well, it's going to affect us massive. This winter, we already visited the doctor 6 times for 3 kids officially. Imagine 7 times 6 is already $42 in 1 month. That will be massive difference.
Probably will, yeah. I'm fine. I work, so, probably won't affect me that much, but I suppose in the long term, that's how they start off with $7 and then start increasing it.
Absolutely. Every dollar counts. And food and energy and transport and communication costs are continuing to go up.
I think many people do feel that elderly people and seniors are definitely getting a rough deal, particularly with the concessions that are also in line to be taken away from them.
They also say that they need to recoup costs given the ageing population, and they can save about $3.5 billion from this measure. Do you think that's a fair justification as well?
It's kind of an argument you could take that off track in terms of educating people about smoking and that kind of thing, educate the youth of today not to smoke, and then there may be less health issues down the line.
I guess you have got to balance the books at the end of the day, but can't we be a bit more creative about it? We can do all sorts of clever things, but why are we still using the same tactics, the same criteria to grab money? You're going to end up with a big pot of money, and who's to say it's going to go into those areas?
Well, they can look at allowing people to have more income so that they can pay a certain amount of tax, which would help, and that way they get some back. But if that's what they would be prepared to look at, I don't know.
The views we received today were mixed, and it seems the issue is more complicated than it appears. This has been Alicia Perera reporting for Undercurrent.